Hi, everyone. Welcome to Get Well with Dr. Shel. I am Dr. Drshelenalaljiaesthetics, better known as Dr. Shel, and I know as a board-certified OBGYN and a functional medicine expert, your health is unique and deeply personal. It is a combination of genetics, lifestyle, and environment. Know this, no matter what your starting point is, you are never powerless over your health. Being on a health journey is a marathon, not a sprint. This podcast is about walking you through many different perspectives on health conditions, symptoms, and solutions that can help you get from fatigued to fabulous. My mission has always been to offer my patients and community the best of mental, physical, and spiritual wellness. You can learn more about me and my wellness center and schedule your telehealth appointment at drshel.com. We can support you no matter where you are in the world. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin. Welcome to Get Well with Dr. Shel. Today we have the wonderful Dr. Darin Ingels, who is a licensed naturopathic physician, an author, an international speaker, and a leading authority on Lyme disease. He is a former Lyme patient himself who actually overcame his own 3-year battle with Lyme disease after having failed conventional treatment and becoming progressively debilitated. Dr. Ingels found that proper diet, lifestyle management, natural therapies worked with his body to heal instead of against it. He then applied these wonderful principles that he had learned about his own healing journey to his Lyme patients and found that they recovered faster and with less side effects. Dr. Ingels has now treated more than 7,000 Lyme patients using his novel and very, very interesting, innovative approach. And many patients who have gone to him now continue to live healthy, symptom-free lives. Dr. Ingels, it is so great to have you, and it's certainly a perfect time considering it is tick season for much of the country. How are you today?
I'm wonderful. Well, thank you so much for having me, Dr. Shel. I really appreciate it. And you're right, this is that time of year where I know we've been all like inundated with COVID-19 stuff, but we're forgetting that this is really the onset of when, ticks really start to become more prevalent.
Absolutely. So I think this is such a great time for this podcast. So thank you for joining us. So you may or may not know this, but I'm kind of a Southern girl. I've lived in Houston for over 20 years now. And before that, I attended school and grew up in Atlanta. So Lyme disease was not something that it just wasn't brought up much throughout my life, nor in my medical training at Emory University. So we didn't really talk about it much. And that's kind of common in most schools with most physicians. We don't really learn much about this. So we're not quite as aware during our practice, but during my functional medicine practice, I've become more and more aware because a lot of patients with Lyme disease come to seek people like us out.
Right.
I understand that you practiced in Connecticut for a long time, home
Yes.
to the town of Lyme, where the name hails. How would you explain Lyme disease to someone who doesn't know much about it? So pretend our listeners don't know much about Lyme disease. How do you explain it?
Sure. Well, very simply, Lyme disease is an infection. It's a bacterial infection, a little bit different than when you get, strep throat or bronchitis.
Right.
These type of bacterial infections tend to be fairly short-lived and generally fairly easy to treat. The nature of the bacteria that causes Lyme disease, it's a little bit different. It's what's called a spirochete. And a lot of people don't know spirochete by the name, but a very well-known spirochete is syphilis. And although Lyme disease and syphilis are really very different animals, they share a lot of common traits, and that they have this kind of unusual corkscrew shape to their bodies, and that allows them actually to get into different tissues. So when we talk about like symptoms of Lyme disease, we'll talk about symptoms that can really affect any body part just because of its ability to get into joints in the brain and your gut. And so there's literally over 100 different symptoms associated with Lyme disease. But it's, it is still a bacteria and does respond to a lot of things that we do for other types of bacterial infections.
Great. That was a wonderful, concise, and great explanation. One thing that most patients always sort of associate with Lyme's is the bullseye rash from a tick bite. But some people may not ever display this rash after a Lyme infected tick bite or may not notice it. What symptoms usually follow once you've contracted Lyme disease, and how do you know to suspect it?
The bullseye rash is really kind of interesting because the CDC says that 70 to 80% of people who get Lyme disease get the bullseye rash. But when you look in the medical research, we find that it's actually less than 50%. And those of us in clinical practice would probably argue it's less than 20%. So yeah, for people who get that classic target or bullseye rash, it's pretty much, diagnostic for Lyme disease. But many people don't get the rash, so they have no idea that they had the exposure. But, common symptoms for people who get acute Lyme disease, you feel sick. It's headache and joint pain and fever and chills, swollen lymph nodes, and sometimes you get what's called Bell's palsy, where one side of your face starts to droop. And, people just feel really terrible. But I think what happens if, you didn't get that early diagnosis, it can progress into something more chronic. And then you start to see more neurological symptoms. People complain about what we call neuropathy, numbness, tingling, their hands feel weak, they feel very heavy, they have brain fog, they can't think straight, their memory, focus, concentration start to suffer, in addition to all the other symptoms that you can see with, sort of acute Lyme disease. Sometimes people run fevers, sometimes again, their body temperature is not well controlled, they start having sleep disturbances, depression, a lot of mood changes. If Lyme starts to affect the brain, you can see any number of neurological effects. So, the sort of the psychiatric side of Lyme really gets overlooked. I think, even for doctors who are aware of Lyme disease, they think about the typical things of, joint pain and fatigue, but they really overlook that for some people, they don't get those symptoms. They may just get more of the brain symptoms. And in which case it'd be easy to shuttle someone off to the psychiatrist and say, go on an antidepressant. Really, the root problem may just be how this infection is affecting the brain.
What an interesting, plethora of symptoms that could fall under this one umbrella. And that just makes it all the more important that we really look into it and test for Lyme. All my Lyme patients that I'm treating right now, they have struggled incredibly because they've gone to, and this because you've treated over 7,000 Lyme patients, much more than I have, but they've gone to 10, 12, 15 doctors who've sort of not, because they meant to dismiss it, but they really haven't looked for Lyme as being, the source of all of these symptoms, because the symptoms seem so either, generalized, or they've been dismissed by putting them into other umbrellas. I feel the same way about sort of hormonal issues, right? I mean, sometimes something that I feel is really important to address and sometimes overlooked, unfortunately, because it's something women experience far too often. There's such a negative connotation when someone says hormones, like, oh, it just must be her hormones, right? And we've entered this era where women's concerns really matter, right? One major issue I see in women just having a, OBGYN training and being board certified in that area, even though I treat both men and women, it's something that I always deal with in my practice and throughout my personal encounters with female friends and families, that it seems like someone has an issue with their thyroid or their sex hormones or their adrenals, perhaps even autoimmune like Hashimoto's. So Dr. Darin, can you make sense of all of these hormonal or thyroid problems when it comes to Lyme disease or other chronic infections? How does it impact hormones in general, and specifically the ones I mentioned?
Well, Lyme itself, because of its effect on the brain, and particularly can affect the pituitary gland. That is our master gland that controls a lot of our hormones. Yes. So I see a lot of people that never had a hormone problem before. So whether it's women in their menstrual cycle or just people in general with their thyroid, and then after they get exposed to Lyme, now we find that they're hypothyroid. Now women complain that their cycles that used to be like clockwork are now irregular and they're all over the place. So it probably has some element of how Lyme specifically is affecting that part of the brain, and that master control is being affected, and therefore everything downstream suffers. So whether it's thyroid problems, adrenal problems, reproductive hormones, I see men sometimes their testosterone levels will drop in the toilet. So there seems to be some element of whether it's Lyme infecting the brain directly, whether it's the immune system reacting to Lyme that's affecting the brain, I don't think, they really elucidated that. Sadly, there's very little research going into Lyme disease. For an infection that is the fastest growing, tick-borne illness in the world, really the fastest growing infectious disease in the world. And knowing that for 40 years, this has been more prevalent,
right.
we put very little money into researching Lyme and looking at, better diagnostics, better treatment. So our understanding of how Lyme impacts people more systemically has really been grossly overlooked. And unfortunately, there's a political issue with how Lyme disease has been perceived. The Infectious Disease Society of America basically treats it like a common infection. All you need is 10 days to 2 weeks of antibiotics and you're fine. Right. And we see so many people that go through that course, if they're able to get properly diagnosed and they don't feel any better, and then they start suffering long-term problems. And the doctor says, well, it's not Lyme disease, you must have some other problem. So, what's really kind of crazy when you think about it is, most bacteria in your body replicate every 10, 15 minutes. So if you get strep throat, if you get on antibiotics, 5 days, 7 days, that's enough to get rid of the infection and you're fine.
Right.
If you get tuberculosis, they'll put you on a triple antibiotic cocktail for up to a year. Why is it so long? Well, we know that TB is a very slow growing organism. So to put this in perspective, if most bacteria replicate every 10, 15 minutes, TB is every 15 to 20 hours. So that's considerably slower. Well, when you look at the research on Lyme disease, Lyme replicates every 1 to 16 days. So why are we content to treat such a slow-growing organism with 2 weeks of antibiotics? Well, we're going to give someone with TB 3 pretty hardcore antibiotics for a year.
Right.
It just biologically doesn't make sense. So we've unfortunately run into this controversy about proper Lyme treatment because a lot of doctors just don't feel like Lyme warrants longer courses of treatment. So we've got the infectious disease side on one side, and then we've got a group out there called ILADS, the International Lyme and Associated Disease Society, that says, hey, look, we know that this is a tougher infection to treat. We need a longer course of treatment. Generally, they treat with antibiotics, but at least it's the recognition that it's not often going to go away with just, a week or 2 of antibiotics.
Sure. Well, I agree. Absolutely. And there's so many different thought processes going on here, and who suffers? It's the patient, right? So I really want to spend a little time on diagnosis and treatment. For those of our listeners who are listening and have wondered, hey, could this be Lyme? As we know, Lyme disease treatment in a typical medical office setting, like you said, would typically consist of an antibiotic, maybe doxycycline, amoxicillin. In your book, like you mentioned earlier, you said that unless antibiotics are administered within 72 hours of a deer tick bite or, of Lyme disease getting contracted, we can see somewhat of a poor track record. So let's talk a little bit about what is the best diagnostic mechanism? What are the tests, and how are those tests different than your routine tests that, doctors will do with LabCorp, or any lab out there, right? What is the difference in those testing mechanism? And then we'll jump into treatment.
Well, according to the CDC, if you go to their website and you read about Lyme disease, they will tell you it's a clinical diagnosis. And what that means is it's based on your signs and symptoms, in particular if you live in an area that's endemic for deer ticks. Right. And the lab test is really just to confirm your suspicion. So at the end of the day, it really is a clinical diagnosis. And again, I think this is where we butt heads with some of our conventional medical counterparts. It says, well, your Lyme test was negative, you don't have Lyme disease. And that's not even what the CDC says is a recommendation on making the diagnosis. So again, for the people who get the bullseye rash, great, we know. And for those who don't, we look at the collection of all these other symptoms. And certainly in my world, when I see arthritic symptoms and neurological symptoms together that have been persistent, at least it's a red flag that Lyme could be part of the picture. So if you go to your conventional reference lab, the standard CDC recommendation is a 2-tier test where you start with a Lyme screen, which is a blood test. It's an antibody test. And if the screen test is positive, then it flexes over to a more specific test called a Western blot, in which case it measures for a bunch of different antibodies against the Lyme organism. But we know that the sensitivity of that Lyme screen is very poor. Again, when you look at the research, it's about 43 to 46% sensitive. So it literally misses more than half the people that have Lyme disease. And because it's an antibody test, it's dependent on how well someone's immune system responds. So if you truly had acute Lyme disease and it was a matter of a week, a few weeks within your exposure, you have a greater opportunity to have that test show up. But
Right.
once you get exposed 6 months ago, 6 years ago, we know that immunity naturally wanes with time.
Yeah.
So the odds of picking up those antibodies the further you get away from that initial infection definitely goes way down. So, there are labs that do specialize in tick-borne illness. The
Yeah.
biggest difference is they use different test kits. The sensitivity of the test is probably a lot better. So, these are the kind of labs we tend to work with that we think offer better testing and therefore give us more reliable information in which we can help make that assessment.
Absolutely. And I think, a lot of patients want to see something, right? Something definitive. And we as clinicians, especially in the field of functional medicine, we are used to seeing the person and their symptoms and really looking at their history and coming up with diagnostic measures and really treating accordingly because we're treating the person, not a piece of paper.
Right.
But yet a lot of people want to see that piece of paper. So there are, as you mentioned, some tests that really go take a deeper dive, if you will, and
Right.
use different testing mechanisms. And I can tell you from personal experience, with my husband having ALS, there were a lot of theories, and there still are, that ALS is neuro-Lyme, right?
Right.
People say things like that. And so I think one thing that traditional medicine is doing for ALS patients is they always do test for Lyme. But guess what test they use? The conventional one that you mentioned that misses over 50% of patients. And so I think that is unfortunately the case with other neurodegenerative diseases as well. So I want to kind of mention MS for a minute. We haven't really gotten the chance to talk about this on our podcast yet. And I know that you have shared your history before. And if you're comfortable talking about it, I'd love to talk about it a little bit because you're doing so well. I don't want to, speak for you, but would you like to talk about that a little bit and how you've approached MS yourself and how you have been able to do all the right things to take care of yourself?
Sure. Well, again, this association between Lyme and various neurodegenerative disorders, I think it opens that window of possibility.
Yeah.
And when you look at the research, we know that Lyme can cause autoimmune, antibodies against the white matter of your brain, against your peripheral nerves. We know that the nervous system can be a target sort of accidentally when you get exposed to the Lyme organism as potentially other infectious agents. So, it's very interesting. Again, my history for people who don't know is I was diagnosed with Lyme disease in 2002. I found it right away. I had all the classic symptoms. I had a bullseye rash. I had 105 fever. So I was treated, immediately. I got better within 4 days of being on doxycycline. But I got bit literally 2 weeks before I opened my own practice. And so when I started my practice, I was doing everything, working long hours. And 8 months into that schedule, I relapsed and started having symptoms again. So I went on antibiotics. It didn't do anything. Changed antibiotics. It didn't do anything. I was on antibiotics for almost 9 months and I got worse and worse. And I was fortunate to have found a Chinese herbalist in New York City that started treating me. And within a month, I felt 85% better. And then from there, it was really just kind of recognition that I wasn't eating well, sleeping well, and really taking care of myself. So all the things I'd sort of been advising my patients to do, I was not doing. Right. So that was my, wake up moment. And, once I kind of started on that path again, it still took me another, I'll say 2 years to get to the point where I really felt 100% well. But I got to a point where I was 100% symptom free and I got a black belt in karate and was being very physically active again. But fast forward a decade later, I started to get, odd symptoms. I noticed that I was doing martial arts and I felt like I didn't have enough power and strength. I was getting tired quickly. I noticed I was tripping a lot. And it still took, of course, I thought it was sort of a relapse of Lyme and I treated as such. And then it took about 3 years to get diagnosed with multiple sclerosis. Wow. So, my opinion is for myself is that I think Lyme set the stage for MS to develop because I have no family history of MS or any of those type of issues in my family. So, when you get these neurological diagnoses, MS, ALS, transverse myelitis, what is it? Guillain-Barré. It's a description. We know kind of what's going on neurologically, but we don't understand the why.
Yes.
And I think this is where conventional medicine just kind of stops. And I don't think it's not that doctors don't care. It's just they don't have that understanding of, what potential triggers might have set it off. There's an interesting article that came out very specifically about ALS. I just read it a couple of weeks ago that was tied in with mycotoxin exposure, suggesting that mycotoxins may be a trigger. We know that with MS, Epstein-Barr virus, human herpes 6, Lyme disease can be a trigger for MS. So in my world, I'm always looking at these other underlying causes, particularly infectious agents, because there's so much research on various infectious agents that can become triggers for any of these neurodegenerative disorders. And if we understand that, maybe that gives us something else that's actionable that we can start to treat and try and get to the root cause of the illness. And I'm sure you're aware of Dr. David Martz. Do you know his story at all?
I've heard his story. It's been some time, though. You can.
Yeah. So David Martz, I mean, his story is open. I'm not sharing anything that's personal. He's been very open, but he was was an oncologist in Colorado. And he was diagnosed with ALS, and he was in hospice. I mean, he was, kind of towards the end of his life. And a friend of his had actually said, "Hey, did you ever get tested for Lyme disease?" No. And I know that he got tested, I think, 6 times before his test came up positive. Right. And in the meantime, his buddy said, "Look, you got nothing to lose. Why don't you try antibiotics?" And he started on IV antibiotics, and he got better. And to make a very long story short, I mean, he basically completely recovered. And he ended up going back into practice as a Lyme doctor and treated Lyme disease and tick-borne illness for many, many years. And he retired, I think, a few years ago, but he's still doing quite well. And again, for me, that was just a good example of how these neurological diagnoses don't really tell you why. So, even when we get the label, we still need a deeper understanding of, what that root cause is. And if we can pinpoint that, again, at least it gives us something actionable that we can, use to treat our patients.
And I couldn't agree with you more. And I see that you collaborate with Dr. Terry Walls, who's such a fabulous example, much like you, of overcoming adversity in the face of her MS. Much like us and what we've been dealing with ALS. I have a lot of patients with Parkinson's and other neurodegenerative diseases that come in, and it's something that, to your point, we should always look at it. We should always look at it as one of the root causes. Something like ALS or MS, it's been associated with so many different things, whether it be toxic exposure, whether it's mycotoxins or heavy metals or Lyme disease or other deficiencies or mitochondrial dysfunction or different viruses, if you will. So it really is important, and sort of, a takeaway as far as diagnoses and workup is truly important if you can find something that is actionable. Because when you have a chronic and debilitating disease, such as a neurodegenerative disease, it's a tough road. It's a tough road. And if there is a way to do something about one or several of the root causes, I've seen my own ALS patients start regaining function, or at least slowing down their progression and just feeling overall better. And sometimes that's what it's all about, is, are you able to lead the quality of life that you'd like to lead, right? And can we identify those things that we as practitioners can address and help our patients with? So this kind of brings me to misdiagnosing can really be a dangerous thing, especially if you start a treatment protocol and you're kind of suffering from something completely different. Why do so many people get misdiagnosed with other diseases instead of Lyme, or vice versa? And why is Lyme so ignored as a probable infection?
Well, in terms of it being ignored, I think the problem is, depending on where you live in the world, there's a lot of places. I mean, where you live in Texas, I know a lot of my patients in Texas are kind of under the impression, I know the doctor, we don't really have Lyme in Texas. You have to go to New England to get it. Lyme's been reported in all 50 states, including Alaska and Hawaii. And not to mention, well, at least prior, I guess, to COVID-19, people used to travel. So, you may not have even picked it up where you live. But, the nature of these ticks, too, is they used to mostly, New England, central, Midwest. And we're finding with climate patterns has changed, is they're taking these ticks everywhere. In fact, I don't know if you saw, it was in the news, they're finding that the ticks on the beaches of California are rampant. So we used to think that away from ticks, and now that's not even safe. So, these ticks have really migrated away. There are areas that we used to think to be dominant, and they're really down completely up and down the East Coast and the West Coast of the United States, pushing in towards the central. I don't know really that there's too many where you can't get exposed to these ticks.
Right.
So, doctor in Arizona. And even when I moved out to California, even now, I still, doctors tell patients that we don't have Lyme in California, which is completely untrue. Even the CDC said years ago that California was the 5th fastest growing state of Lyme disease in the country. A lot of ignorance on behalf of healthcare practitioners that they're not really understanding that Lyme is as prevalent as it is. So therefore it's not on the radar. And yeah, I guess depending on when you went to school, Lyme probably wasn't taught. Look, I was a clinical microbiologist before I was a doctor. So I came out of a world of working in infectious disease for 5 years before I went to medical school. But having gone through medical school microbiology, where Lyme was probably a 20-minute discussion. I was in Seattle at the time. At the time, Lyme was really not thought to be any problem in Washington State. So it just wasn't, it was not anyone's radar. And therefore you get out in your clinical practice, and if you don't really look for it, you won't find it. But I think as doctors become more educated about how common it is, how these people that have these sort of chronic persistent symptoms often can be tied into Lyme or some other tick-borne illness, the awareness has definitely changed. But I still think we have a long way to go to educate practitioners on looking for it as a diagnosis.
Agree completely. And I think, what you're doing is moving the needle for sure, because you are out there, you're educating, you're writing books, you're doing podcasts like this. And I really appreciate your efforts that you are spending in trying to, not only educate patients, but also practitioners, because I think that, just like you said, we haven't been taught what we haven't been taught, and we need to learn this on our own. I'd like to switch gears a little bit to treatment, and you have a very innovative approach that really works for your Lyme patients. Of course, everybody knows about, there's a lot of heavy antibiotic cocktails, and sometimes that's good for patients. Other times it actually makes them sicker after a prolonged course of heavy antibiotics if not done correctly. Can you explain what forms of treatments that you recommend to prevent Lyme disease from turning into, Lyme to chronic Lyme? And also, what exactly is the line of demarcation between Lyme and chronic Lyme? How do you treat them differently, and how do you identify them?
Yeah, well, the line between acute and chronic Lyme, I mean, it varies from person to person. I think it has something to do with their degree of symptoms. I mean, if someone comes in, they've got 104 fever, they're acutely ill, we can say, yeah, you're in that acute Lyme phase. When, they don't get the fever anymore, it's those chronic nagging daily things. That's more when they get into the chronic phase. Sometimes people know when they started getting sick, really aware. Other people aren't as aware because the onset was really slow and kind of insidious. So if someone says, yeah, look, I've been sick for 3 years, that would be in the category of chronic Lyme. When you start to get to that, 3 month, 4 month, 5 month mark, and that's probably where people really kind of transition out of that acute into more chronic Lyme. And especially if they got early treatment. If you got early treatment and you're still not feeling well, that may be a sign that there's more of a chronic or persistent Lyme. And there's actually some interesting research that even when you get acute exposure to Lyme, there are some Lyme bacteria that are already kind of resistant to treatments. They call these persister cells. So it's almost kind of like, even though you got bit acutely, you already got chronic Lyme, even though you got exposed within a matter of weeks. So it's a crazy phenomenon that we don't really see with other types of bacterial infections, but the nature of Lyme seems to kind of facilitate that. So a lot of it's really based on clinical symptoms, time of exposure. From a treatment standpoint, really the big difference sometimes is, the type of, herbs I might use, the dosing of it might be a little bit different. What I find when people get more to the chronic phases is that they tend to be a little bit more hypersensitive. The nature of having Lyme longer seems to sensitize people to different things. So people can become sensitive to food, mold, pollen, chemicals, and that includes sometimes whatever we're using for treatment. So we have to ease into it a little bit more gently, where when it's acute, we kind of go in at full strength just to try and, hit it hard, nip it in the bud before it becomes more problematic. So that's really kind of the difference. And in regards, to treatment, it's really a whole person approach. I think, where I might disagree with some of my Lyme counterparts is they really focus on killing the bug. And although killing the bug is a good thing, we also don't know that you get rid of Lyme completely anyway.
Right.
So is it something kind of like a virus where, if you get a herpes virus, once you get exposure, you never ever get rid of it. And I don't know that we have very compelling evidence that when you get exposed to Lyme, that it ever completely goes away. Right. So do we completely eradicate it? Do we just manage it? We don't really know. And unfortunately, we don't have testing available, at least good testing, that tells us about whether Lyme is really there in your body and active. We don't really know because we depend on antibody tests. Right. So, from my perspective and what I learned in my own journey is that you got to look at the whole person. It's not just about whatever you're doing to kill the bug. That's part of it, but you have to look at, gut health. I mean, your gut, represents up to 80% of your immune function. If your immune system's not functioning well, how can you get over any infection? Sure. I think this is where sometimes the long-term antibiotics become problematic, is that it kills off a lot of your normal bacteria. Right. Not to mention it can damage your mitochondria, which is that part of your cell that you need for cell repair and energy metabolism and things of that nature. Mm-hmm. So it's, it's gut health, it's diet, obviously what you eat, this is giving you all the nutrients that your body needs to repair itself. I think the beauty of the human body, right, is that it is built into our DNA to heal. We just need to give it the right things to allow that process to happen. And when it's not happening, again, what is it that's stopping this natural process from occurring? Again, there's some persistent toxin, some persistent infection. So again, this is where we as functional medicine people are trying to figure those pieces out to try and get that obstacle out of the way. But it is built into our genetic code to repair tissue, even really severely damaged tissue. Right. So, we've got to make sure that whatever people are putting in their mouth, and I tell my patients, I'm like, either food is helping you or it's not. Food is medicine. And it's important. And, Terry Wallace comes from the same perspective. And I really kind of follow her diet, which is kind of like my book too, where it's really mostly plant-based diet, minimal, lean animal proteins, and obviously nothing that's pro-inflammatory, all the junk processed foods, GMO and that kind of stuff. So, make sure you're eating the right stuff can be helpful. In terms of active treatment, I use herbs. I'm a naturopathic doctor by training, so herbs are in my wheelhouse. And again, having treated a lot of people, including myself, I have complete faith in herbs and I see what they do. And the fact that they're able to help, get rid of Lyme or at least keep it at bay, potentially more effective than antibiotics in some cases. But again, it doesn't have that same negative impact onto your normal microbiome, and it doesn't damage your mitochondria. And the other beauty about herbs too is, think about it, herbs have a lot of different constituents in it, right? So, not only are they targeting Lyme, they're anti-inflammatory, they're promoting better circulation, they're helping boost your immune system. So we can really mix and match herbs to find out what each individual person needs to meet their specific needs.
That's fantastic.
And then beyond that, just looking into the environment, environmental control. Again, if you live in an area with a lot of, chemicals, pesticides, if you've got a house that's loaded with mold and mycotoxins, and gosh, mycotoxicity and Lyme are probably the two most similar looking things clinically. Absolutely. So a lot of my Lyme patients have had exposure to mold. And at that point, we can't really tell what symptoms are mold, what symptoms are Lyme. You kind of have to treat both. But just understanding that, your surroundings, your occupation, all of that makes a difference in how it impacts your health. And then the last part of it is just looking at, how well are you sleeping? Are you moving your body at all? Are you doing these other types of lifestyle factors that really facilitate your health? Do you need to meditate? Do you need to relieve your stress? I mean, gosh, this last year and a half where I think everybody's been such a stressful year for so many reasons. We've all got to find those ways to help manage our stress so that, again, we really optimize our health.
What a great overview. And I think that the message is you've got to practice a complete lifestyle approach, right? Manage your stress, manage your sleep, manage your, try to meditate, do yoga, move around, exercise, use food as your medicine, stay away from pro-inflammatory foods, and then rid your environment, whether it be mycotoxins, like you said, or EMF, which is a very big toxin to us in general. And all of us have cell phones and Wi-Fi around us all the time. So whatever we can do to manage our environment, clean our environment, and then you, of course, do the treatment with the herbs and the nutrients, etc. If you had to tell our listeners your top three favorite herbs, what would they be? And I'm sure you have so many, but what would be some of your top favorite herbs for people with Lyme, or, Lyme and autoimmune diseases or neurodegenerative diseases?
Yeah, I love Artemisia annua. This particular species of Artemisia, which is actually a weed, it probably grows in a lot of people's backyard. But
Mm-hmm.
Artemisia is very effective at treating Lyme. It also does treat things like Babesia and some co-infections. But it also has this unique property that it modulates the immune system. They've actually done studies and even things like rheumatoid arthritis as a way to
Right,
help modulate inflammation. So I think you get a lot of bang for your buck with, Artemisia. I
right.
like cat's claw a lot. Cat's claw is a well-studied herb, very well-known antimicrobial. I love it. Dr. Lee Cowden calls cat's claw one of the keep herbs. Kept talking about keep herbs, Keep. And I said, well, what's that? He says, well, it kills everything except people. So it's antibacterial, it's antiviral, it's antifungal, it's antiparasitic. So
Yeah.
again, when we use these herbs, we don't, unlike antibiotics, that sometimes you have to give an antifungal because you might create a yeast problem by giving antibiotics. With the herbs, because they're kind of keeping your total ecology under control, we don't have to do that. So I love cat's claw. And my third most favorite, gosh, it's probably a toss-up between, I like Hatunia a lot. Hatunia is used a lot in Chinese herbal medicine.
Uh-huh.
It's very against Lyme and a lot of infections. And Japanese knotweed. Japanese knotweed was kind of brought to the forefront by Stephen Buhner, who's a well-known herbalist in the Lyme world.
Uh-huh.
Japanese knotweed's been studied in research and found to be highly effective against Lyme and Bartonella and some of these other co-infections. So those are probably my top 3 or 4.
Those are great. And I'm so happy you mentioned Lee Cowden. He was a part of our ALS mastermind that we had done in
Right.
2019, and just a very, very good friend. In fact, we had treated my husband with, his Cowden protocol back in 2018. And much like you, he's a fan of all of these herbs, which I think is just a testament to people like you and Lee, just, really being on the cutting edge and the leading edge of this. So, yeah, I mean, I respect him tremendously. I want to kind of just ask you about autoimmunity just one more time, about how it's such a hot button issue right now, especially in the world of functional medicine. We see so many people with autoimmune conditions. And we've kind of talked about this. Lyme infection has a connection perhaps to autoimmune disease, whether it's Hashimoto's or rheumatoid arthritis or other things that are going on. What is it about? It's a two-part question. What is it about the, Lyme disease that triggers this? And number two, we've talked about a few different co-infections. We talk about whether it's Babesia or Bartonella or Borrelia. How do you kind of simplify this for our listeners? What do you normally look for, and how are those co-infections different as far as presentation?
Well, the first part of your question about autoimmunity, again, we know that in the immune system's effort to try and eradicate Lyme, there are generally proteins on the surface of the bacteria that structurally look similar to something that might be found in our own tissue, something in our joints, something in our brain. So as the immune system amps up to try and fight the infection, those antibodies accidentally cross-react with our own tissue. I mean, that's really the nature of any autoimmune disease, is that your immune system's attacking something that's part of you. So
Right.
what we call immune tolerance has been lost. Your body is not discriminating what's part of you and what's not part of you. And so that's the nature of really any of these sort of microbe-driven autoimmune problems, is that your body's trying to fight the infection, it accidentally just starts attacking your own tissue. So with Lyme specifically, again, we know it targets, the brain, the peripheral nerves, the joints in particular. That's what we know from the research. And again, there's plenty of other microbes that can cause similar kinds of issues. For people who really geek out on this kind of stuff, you can just go online and type in any condition, migraines, ankylosing spondylitis, and then put and molecular mimicry. Molecular mimicry is the mechanism by which these different microbes start inducing that autoimmune reaction. And it's amazing how much research finds out there of what we already do know between different bacteria and viruses, sometimes even fungi or parasites that can trigger these type of inflammatory reactions. So, that's really the nature, again, of the autoimmune process. And in terms of these co-infections, there's a lot of clinical overlap in symptoms. When we do our initial testing, we're usually testing for everything, because symptomatically, if someone comes in and says, look, I'm tired, my joints hurt, I've got headaches, it can be any number of different, microbes. There are a few characteristics that are unique to individual bacteria in particular. Bartonella. Bartonella tends to cause a burning type of neuropathy, where Lyme might just be more numbness and tingling. Bartonella can cause these look like stretch marks on your skin. What's unique about them is that they're perpendicular to the natural folds of the skin. They tend to occur on the torso, on the hips, the thighs, the buttocks, sometimes for women up in the breast area. That's sort of unique to Bartonella. So again, you'll see these, it looks like stretch marks, and it had nothing to do with weight changes. You'll see this sometimes in very thin people, and their weight hasn't changed at all. Babesia might be a little different. It's a blood parasite. It's actually a cousin of malaria. So people will get cyclical fever, usually every week or so. They get a spike in their fever. They might get anemia. They'll get this thing called air hunger, where they just can't feel like they're getting a deep breath. With things like Ehrlichia, Anaplasma, because both of these infections can invade your white blood cells. Although clinically you might not be able to distinguish it, but if you run a blood count, you might see their white count drop. So we got a few little clues like that that can sometimes hone in on what it is. But so many of these other symptoms are generally vague. They overlap with all of them. And, fever, fatigue, swollen glands, chills, headache, any of that would be any number of them. So I think a lot of us in the Lyme world, we just test kind of for the gamut, at least of the things that are most common in our area, or at least wherever the patient comes from. And then from there, if we need to do more specific testing, we can. But it's good to kind of get that out of the way just to see, is it Lyme plus? When I lived in Connecticut, we knew that the ticks in New England, up to 33% of them carried one or more co-infections in addition to Borrelia or Lyme organism. So I think as clinicians, it's good to know what we're dealing with.
Absolutely. Well, no, thank you. That was interesting, because a lot of people are a little confused because they hear the words, they hear Borrelia, they hear Bartonella, they hear Babesia. So I wanted them to kind of get an overview of how you differentiate and how certain symptomatic pictures might be specific to some of the co-infections.
Right.
Dr. Darin, it was great to have you on as our Lyme expert. I mean, your information and your expertise is just so refreshing. There are so many moving parts to chronic illness. And my mission with this podcast is to give my audience as wide of a repository as possible to really truly better their health long term. I see you're hosting a masterclass in August called the Overcoming Chronic Illness Masterclass. And I recommend all of our listeners, especially those suffering with chronic illnesses, to go to Dr. Darin's website in our show notes and sign up for the latest updates about this masterclass at DarinIngelsND.com. That's DarinIngelsND.com. And definitely take advantage of all of his expertise that he'll be sharing. Once again, Dr. Ingels, thank you for sharing your story, which was super powerful. I think when we have personal struggles and we use that as a transformation and as, a teacher to teach others to really overcome and combat a lot of the illnesses that we ourselves have dealt with, I think it just makes it so much more powerful. It's really a pleasure to talk to you today and to be here with you. So thank you for taking the time to educate our audience about everything that you're an expert on.
Well, again, thank you so much for having me. It was a pleasure to be able to share my story and hopefully inspire people to, take control of their own health and be their own best advocate.
Absolutely. Thank you again. Take care. And everybody, we will join you again in our next podcast. Until then, goodbye. Thank you so much for making time for today's podcast with Get Well with Dr. Shel. I know that this conversation and education can help you to create your best life possible on every level. So definitely tune in to hear the newest expert and learn the latest protocols to support your best health journey. You can learn more about me and my wellness center at drshel.com, drshel.com, and I hope that you will make time to come visit us in the Houston area to take a deep dive on self-care. My team and I are completely devoted to helping you live a better life from this moment forward. The best days of your life are ahead of you, I promise. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin.